Hello, welcome to this NMC OSCE video looking at the evaluation station. My name is Hannah Ames and I am an experienced UK nurse of 20 years and a UK university lecturer of over 6 years, and I've been a lead OSCE trainer as well. So I'm sharing some of my kind of top tips for these stations so you can support your study at home and be successful in your OSCE as well. Okay, so I'm going to be looking at the evaluation station. So this is the last station in your API. So you've got your assessment, planning, implementation, and evaluation station. So it comes at the end of your API. And it's an 8-minute verbal station. Okay, so you'll have this station and you'll have access to your paperwork and all your briefings from your other API stations. So you'll have your assessment paperwork, your News 2 chart or GCS chart, depending on what scenario you've had. You'll have your care plans, you'll have your medication chart, and it's really important you have all that information, and if you don't, you need to alert the examiner to that, okay? And you'll have a briefing about your patient. So it'll be the same patient that you've had throughout your whole API, and you'll get a new set of observations, and you'll be asked to hand over your patient using SBAR. This could either be to a doctor or to another nurse. So the evaluation briefing will tell you the latest information about that patient. So it could be that your patient is now ready for discharge home, for example, and you're handing back over to the community nursing or GP team, or your patient is has been in the emergency department and is now being moved to the ward, and you're handing over to the ward, for example. It's really important in this station, although you will have access to all your paperwork from your other stations, that you do not alter anything on the other station's paperwork. Okay, you mustn't write on your assessment information, your planning information, or your drug chart. If you do alter anything on those other stations, then you will be failed, and they will consider that malpractice, and they will refer you and fail you across all your 10 OSCE stations. You will need to go back and repeat, okay? So you mustn't alter any paperwork from your other stations in the evaluation station. That is really, really important to remember. Even if you noticed a mistake, say you noticed a mistake on your News 2 chart whilst you're looking through that, you cannot alter that in your evaluation station. So you have 8 minutes and you're asked to verbally hand over using the SBAR. So that's situation, background, assessment, and recommendations. So we advise that you spend half your time, so 4 minutes, 3.5 minutes, planning your SBAR. Okay, so you'll get a piece of paper to write on. That written bit of paper is not assessed, so it doesn't matter how you write on that, as long as you can read and understand it, and to use that to support you in your SBAR. So it's good to take some time to plan. Okay, go through your paperwork that you've got from your other stations and identify what bits of information you're going to hand over. So when we start with situation, you've got to identify yourself, your role, and the unit or area that you're calling from. Okay, so like, hello, my name is Hannah. I'm the registered nurse working in the emergency department, for example. You then have to go on and identify your patient. Okay, so their name, their hospital number, and their date of birth, and where that patient is located. And that might feel a bit repetitive because you've already said you are in the emergency department, but you need to say also where that patient is. Okay, now you must hand over this patient has any allergies, and this is not in the marking criteria, but if you do not do that, it will be a critical fail. So at some point you need to hand over if they've got any allergies, and I just always teach to do that early on with that patient information, so it's really clear. So hand over their name, hospital number, date of birth, where the patient is, and if they've got any allergies and what reaction that is. If you forget, don't worry, but make sure you do it at some point during that OSCE, during that evaluation, sorry. And then you've got to describe your concern, okay? So remember, this is the current situation of your patient. It's not the background history or the past medical history. It's what is your primary concern. So from your briefing information, you might have some observations on there. You might be able to pick up something that maybe is concerning you. So you want to pick up what is your primary concern. So it could be, I'm really concerned about this patient because the respiratory rate is increased and the oxygen saturations have decreased. I'm really my primary, you know, you may not have any concerns. The patient might be stable, so you know, you could be just your reason for handing over. So I'm handing over as the patient is you know, due to transfer to your ward and to hand over the ongoing nursing care. Okay, so just try, you need to either identify if there's a concern, and if there isn't, you're handing over ongoing nursing care for this patient. Then I'm going to go on to background. Okay, so you need to give the patient's reason for admission and date of admission. And you'll get this from your assessment paperwork, which you had in your assessment station. Okay, so use that, look through that. You need to give the past medical history, their medications that they're normally on, and any medication risk factors. Okay, so you know when you read the front of that drug chart, the bottom of the first page, it might be crossed if they were diabetic. Okay, and again, you'll get all that information from your assessment station and your implementation station. Okay, you need to hand any results of any investigations. So say if the patient had a CT scan or an X-ray or has been to theatre, so you need to hand over that information. Now, you must hand over the social history. This is really important, okay? And maybe not something we might naturally do with our handover. And again, you'll get that social history from your assessment briefing, okay? So you need to hand over the social history of that patient. So it might be that they live alone, that they recently bereaved, you know, anything you get from that social history, that they're a smoker, a drinker, for example, okay? And then you go on to hand over your assessment information, okay? And what you need to do first is hand over the assessment observations that you took and recorded in your assessment station first, okay? So you would say on initial assessment or on my first assessment, and you need to hand over each vital sign, okay? So the respiratory rate was 20, oxygen saturations were 98, and you need to say every vital sign. Okay, if you did any other assessments in that assessment station, you need to hand those over. So for example, pain score 6 out of 10, or if you had a scenario where there was a must to calculate, you'd hand over the must score as well. So any other additional assessments, okay, anything relevant from your holistic assessment, okay, so from initial assessment, you know, patient you know, was at risk of falls, you know, so whatever you identified from your initial assessment as well, okay? And then you lead on then into the rest of your assessment information. So then you need to state the most recent observations. So in your station briefing, you will get a new set of observations for this patient, okay? So you need to then read out their current observations, okay? So current observations are this. And again, you need to read each vital sign. So respiratory rate is, say the respiratory rate is now 30. I'd say respiratory rate is 30. But you have to identify any changes from your observations that you did in your assessment station. Okay, so it could be respiratory rate is now 30. This is increased from 20. Okay, so that is really important. Identifying changes between the new set of observations they give you and the observations that you took and recorded in your assessment station. You need to identify main nursing needs. So this is where you can pull your information from your care plans, okay? So what were your primary care plans? Yes, so main nursing needs could be management of pain, management of shortness of breath. Pick some interventions that you carried out, yes? So it could be that we referred to physio, we nursed the patient in an upright position, we've given regular analgesic medication, okay? It might be that you've done your News 2 monitoring as per your policy. So if your News 2 scoring came out as hourly monitoring, that doing your hourly News 2 is a nursing need and an intervention. Okay, you then need to hand over any medications prescribed, okay, and what you've given. So this is where you go to your implementation drug chart and you read out what medications you've given in your station, okay. And also you must include if you've omitted any medications, okay? So for example, if you've not given warfarin, which is an anticoagulant because the patient has had a bleed, you're going to say you haven't given that. Or say you didn't give the antibiotic because the patient's allergic, you need to hand that over, okay? You also need to hand over any other medical interventions, anything else that you get in any of your briefing or history of the patient that you haven't handed over. And again, if you are concerned about this patient, you hand over your main reason area of concern. So I'm really concerned about this patient because their respiratory rate is increasing and they're showing increased signs of work breathing, for example. Okay, well, it could be that you're handing over this patient, to the nurse coming on shift, and it could be maybe they're a post-op patient, and it could be, I'm just want you to continue monitoring this patient for post-operative complications such as bleeding. I want you to reassess their pain because their pain was quite high in 30 minutes. So you need to think about the context of that patient and what you want that person to be doing as well. And then you're going on to your recommendation. Okay, so what would you like to happen at the end of your SBAR by that person that you're handing over to? Okay, so explain what you want them to do. So for example, if your patient has deteriorated and is very unwell, you want that doctor to come and review that patient as soon as possible. Add a time frame to it. Okay, so I'm really concerned about this patient. Their respiratory rate has increased and their oxygen saturations have decreased. I'd like you to come and review them as soon as possible. Don't be afraid of saying as soon as possible when a patient is unwell and showing signs that they are deteriorating. We need that person to come and see them straight away. Okay. Quite often you're handing over like a shift-to-shift basis, okay? So you're handing over to the next nurse. So just think again in practice in your nursing careers, what information you give at a handover, okay? So for example, I might want the following nurse to continue News 2 monitoring as per the policy, assess pain using the universal pain scale, monitor fluid input and output every 24 hours, or maybe review the post-op wound in 48 hours. So be really clear, if you are handing over to a nurse, think about all those things that you'd want that nurse to do on the following shift, okay? So key steps to this really is to take time to read all your paperwork and make notes, okay? So like I said, give yourself 3 minutes to 4 minutes to make your notes, because if you've got some really clear notes, it's going to save you a lot of time searching through the paperwork, okay? And also you're being assessed on a really systematic a really systematic evaluation, sorry. So you need to be, the information needs to flow nicely, okay? You don't want to be stopping and trying to find a medication in a drug chart, and also you won't have time, your time will run out, okay? Make sure your verbal communication is clear, okay? Make sure you are familiar with the marking criteria and you know exactly what you need to say in each part, okay? You do need to learn that, okay? And try and practice as much as possible with your friends, with your family, okay? You can record yourself on your phone and then listen back and tick yourself off against the marking criteria. Okay, that's a really good way to self-assess yourself if you're practicing at home to see which bits you've missed. Okay, so I would also recommend that you make clear notes. Like I said, if you've got some clear notes, all you need to do is just read that then to the examiner. Leave yourself at least 4 minutes to do that verbal handover, if not maybe 4.5, okay? And do the rest of your time planning, okay? Make sure the information you are saying matches the marking criteria, so become familiar with this, okay? Feel confident and try not to rush. I know time is tight, but try not to rush and use the SBAR order, okay? Know where you're going to find the key information from your previous station paperwork, okay? So I know I'm going to get all my social history and my past medical history from my assessment station. I know I'm going to get my medications that I've given from my drug chart. I know I'm going to give my nursing needs and interventions, from my planning station, okay? If you forget anything, just go back and add it, okay? That's absolutely fine. So if you get to the end, you've still got time on the clock and you think you've forgotten something, then go back and add it in, okay? Say to the examiner that you forgot and you wanted to hand this over. Don't forget to hand over the allergies and medication risk factors. That's really critical. And because it's not on the marking criteria, it often gets lost. Okay, so I hope you enjoyed this short video. I'm doing one-to-one and small group tutoring online, face-to-face in a local area, but that's subject to kind of availability. You'll get access to recorded lectures. We'll go into these topics in a lot more detail. We've got full APIs for all the conditions, all the 12 conditions which you can have access to and practice to, example care plans, professional value evidence-based scenarios for you to practice as well, and also clinical skill guides and support with that. So you can drop me an email or you can visit my Facebook page, Nurse Tutor Tutoring with Hannah.